kind of the topics that I'm focusing on tonight is kind of coping with body and intimacy changes following cancer treatment. And a lot of what I'm talking about can also be implemented during cancer treatment as well. But just kind of some of it may be geared more to some of that post-treatment life, but certainly things are applicable for those that are kind of going through the the cancer treatment process as well. Okay. So I want to start off the conversation by just kind of reviewing what exactly is body image. So body image is really how you see yourself, mentally and when you look in the mirror. And this is when you can influence our self-esteem, which is related to body image, because self-esteem is how you value and respect yourself. So sometimes when you're diagnosed with cancer, it can have a negative impact on your body image, but therefore can impact your self-esteem or your feeling of confidence, really. So the two concepts are kind of intertwined, but when we talk about body image, it really is how you see yourself. And there are some common body changes from cancer that we see, and some of these changes may be temporary or permanent. It just kind of depends on the situation. So I have a few photos up there, but as you can see, there could be scars from surgeries, hair loss from treatment. There could be changes in shapes or sizes of your body, such as lymphedema is a common one, or there might be skin changes. If there is redness or itching or sensitivity specifically, that can happen with radiation treatments, and that might take some time to kind of resolve. But there might be some skin changes in your skin feeling just not so comfortable. Other common body changes that we see from cancer and cancer treatment is weight changes. We see people either gain weight, and sometimes that can be a result of like steroids or not being as active as they once were because of everything they've gone through. Or we can actually see quite a bit of weight loss because your body's having a hard time keeping up with the caloric needs that it has while going through cancer treatment, or because of things like nausea, it makes it a little bit harder to keep that food down. So we do see a fluctuation in weight often. And I think one of the most common symptoms or changes that we feel within our body is the feeling of weakness or fatigue. I feel like that's kind of common across all different types of cancer treatment, not specific to one where some of these others are, but fatigue is really a real thing and really can be difficult to cope with as you're going through treatment and kind of trying to figure out what to do after treatment. And something that doesn't get talked about a lot, and we're going to be broaching this a bit today, is kind of the changes that in your sexual functioning due to cancer. And this could be loss of interest in sex, erectile difficulties, vaginal dryness, infertility, early menopause, or, and related to some of that, maybe loss of interest, how do we, if that is something that's important for you to get back, how do we do that? Or do we kind of transition and focus more on some of the other types of intimacy that is available outside of sex and physical intimacy? What are the impacts of these body changes on a person? And sometimes when we have these body changes that are more visible, it can make you feel more uncomfortable because it's something that you're always seeing in the mirror or you're having that reflection on. Sometimes when things are a little bit more hidden on our bodies, it's not so much in your face, and maybe it might be a little bit easier to process. But when we're looking at ourselves and we're noticing these changes, it can make you feel a little uncomfortable. It does take time, and I think that's kind of the big theme for a lot of what I'm talking about, is just giving yourself time to process and move forward. Because once you are going through cancer treatment or finishing cancer treatment, it doesn't exactly get back to normal from there. It's kind of relearning where you're at now and managing those expectations of yourself and your body during that time. And some of these changes can lead to increased feelings of depression and anxiety. And there could also be feelings attached to your body, even if there are no lasting physical changes. Maybe you had cancer treatment, or you are going through cancer treatment that's not going to have some physical changes in you, but that doesn't mean that some difficult feelings about your body won't arise. And these body changes can influence your ability to or desire to be intimate with your partner or partners. So when we think about body changes, some of the negative themes that are often brought up in working in oncology is that you lose confidence in your body and its abilities, or feeling that your body has let you down or that it's weak or vulnerable. And sometimes, even if, as I kind of just said, when we don't have those physical representation of body changes, oftentimes people are still disappointed or let down in their body because it still led them to have cancer in some way. And some of this negative frameworking kind of develops in that negative self-talk, and therefore that also can impact our self-esteem. As a negative impact of body changes, it has this inability for you to feel comfortable no matter what you wear or how you're styling yourself, with a wig or without a wig, with makeup, putting on eyebrows, lashes, anything like that. And oftentimes, negative thoughts can lead to negative behaviors. And this is where we see issues with anxiety or depression arise, that sometimes you might be avoiding social situations where you'll be around people you don't know well, or you won't put yourself out there because of your concerns about how your body has changed through all of this. So that leads to isolating and some negative behaviors to arise. So oftentimes, we kind of maybe remove ourselves from situations because we don't necessarily want to see the reactions that other people have to us, especially if we do look differently or feel differently about our body. And a lot of times sometimes people may look a little bit differently at you, or look a little bit longer. And oftentimes it doesn't come from a place of hurt. They're not trying to upset you or be negative. They're just a little bit more curious. So kind of like a tip in how do we manage other people's reactions is to prepare, kind of like prepare responses to different social situations, so that if you are at an uncomfortable question, whether it's well-meaning or not, you have a response prepared. And so you could say like, oh, someone asks me about my hair loss or about, the way my body looks. I'm going to say this, kind of have some prepared responses to things that might help you feel more confident and help you feel like more in control, because you already know how you're going to manage those questions if they get asked. And hopefully it'll help you kind of get back into some of those social situations or things that you did before, like hobbies or sports or work. Now, because our body changes because of cancer and cancer treatment, doesn't mean it's all negative changes. There can be some positive things that we learn about ourselves and our body through cancer and cancer treatment. And one of those things is just kind of being more aware of your body. I think a lot of times people kind of forget how their body moves, and you might be just more aware of your body, what feels good, what doesn't, and kind of just being more in tune with things. You may also have really good feelings about being stronger because you got through treatment, or your body's getting through the treatment. And so there's some strength in that body that you may not have had before. Sometimes after a cancer diagnosis, people feel a little energized and motivated to treat your body well, that we're going to make some healthy lifestyle changes with diet and exercise to really help our body stay well through this experience and after this experience. It can also help you appreciate what your body does. The human body is a magnificent, amazing thing. And maybe we have a new appreciation for all the work that it does for us. And then finally, and I think a big shift for some of us in this culture that we live in, is that understanding that really what we look like has nothing to do with who you are as a person and the value and talents that you have. I think a lot of times within our culture, we really kind of tie looks to status. And really, it's kind of recentering or realigning within yourself that looks really aren't everything. They certainly can be difficult to cope with these changes sometimes, but you are more than your body. You are more than what cancer has done to your body. So how can we try to shift our thinking to promote a more positive body image versus some of those negative body images? And some tips is to kind of work on learning to love every part of yourself. And this will be a process, and there's no perfect way to do this, but what is something that you like about your mastectomy scar, about your ostomy? What is something that you like about those parts of your body that had been through so much and helped you survive or go through cancer and cancer treatments. It's also really setting expectations that are realistic for yourself on what you can do right now and who you are right now and not who you were before, because your body and your life is forever changed by a cancer experience. So really kind of set expectations, especially if you're experiencing things like fatigue or something like that, about what you can do, and really focus on what you can do versus what you cannot do. Really try participating in activities you love or finding new ones. Really kind of maybe put yourself out there a little bit more. This might help you feel more positive and confident, which can impact your self-esteem and your body image. And it also gives you something fun to do. A lot of patients sometimes get into yoga or meditation, or they get into some of the art or other therapeutic programming that organizations like LivingWell offers that really kind of fulfill a piece of you and makes you feel more in tune and positive about yourself and this experience in your body. And if a great way to kind of help formulate and work on how do we promote a positive body image, if that's something that we feel really stuck in being able to do, is to work with a therapist. These can help you apply and come up with ideas to what best works for you. I think therapy is a wonderful tool in a lot of what we talk about that will help us promote a positive body image and positive intimacy as well. So overall, coping with these body changes, as I've said before a few times already, and it's the theme of most of what I talk about, is give yourself time. You almost have to grieve the changes in your body, that the body that you had, things removed from it. Maybe you had your uterus removed or your prostate removed. What does that mean to you? Allow yourself to grieve the changes in your body and give yourself time to adjust and heal as well. And remember that you're still you. Even though your body may look or feel different, you at your core are still the same person, and you may have discovered hidden strengths within yourself that you didn't know you had until you were faced with something like this. It's really important to be around people who support you and are going to help build you up and help you kind of promote and continue to cope in a positive way with some of these changes. And as I mentioned earlier too, eating well, getting enough sleep, exercise can help improve your mood, reduce fatigue, and give you strength. I think we talk a lot about this part of like self-care and working on doing those things, but all of those tips and tools really can help you just kind of feel better about your body and in more control. I do want to state, like, if you've been through treatments or you're going through treatments, to really check with your doctor before starting any new exercise routine, because you don't want to exacerbate anything, especially if you've had surgeries where lymph nodes were taken out, making sure that you're not pushing it so that something like lymphedema doesn't develop. And if you're able to embrace humor and stay calm through this, that's a really great thing to try to do. Laughter has many positive effects on the mind and body. When we laugh, that kind of releases happy things firing in our brain and kind of helps us feel good about ourselves. There's also this whole philosophy of laughter yoga that's pretty popular in certain parts of the world. So really, if we can try to find the positives, embrace some humor, that might also help us in overall coping as well. It can also be really helpful to talk to other cancer survivors. How do they cope with things? How are they doing with an ostomy or a nephrostomy? How are they doing post a mastectomy? Or how do they cope with losing their hair from chemotherapy? Really kind of talking to someone who knows what that experience is like and how they coped with the body changes can be really helpful. And there are support programs where you can connect individually or one-on-one with another cancer survivor, or there's a variety of support groups in the area. I know LivingWell has quite a few support programs or support groups that you could join and connect and have these kinds of conversations if you feel comfortable doing that. And you may also want to talk to your doctor about your concerns. Talking about our feelings and thoughts in our body doesn't necessarily make you vain, and that can be a fear for a lot of patients, that they don't want to be seen as vain or focusing on the wrong thing. But I think it's good to ask your doctor, because there could be options that could help with body image. There might be some more surgery involved that can reduce scars or rebuild tissue or to reverse a process that we did to you. And so there might be something available through your physician that you just won't know if you ask. And there may, at least you have that conversation and knowledge. So how does these body changes and going through cancer or going through cancer and treatment impact your intimacy? So a lot of times when we think about intimacy, we think of sex, but intimacy can be more of that. And I have this cute little graphic from a website that shows the different types of intimacy. Of course, there's that physical, but there's also intellectual, emotional, spiritual, and experiential intimacy as well. And for the purpose of this talk, we're really going to focus on physical intimacy and emotional intimacy. So what exactly is emotional intimacy? And really that is like that closeness between two people who feel safe and secure with each other, someone that you can share your deepest feelings, insecurities, and dreams with without fearing judgment. It helps you feel valued and understood by your partner. And this can be a romantic partner. It could be a friend. There are no romantic feelings attached to, but it's really that sense of closeness. And to have emotional intimacy, it's really done through vulnerability, trust, and communication done through both partners or multiple partners, depending on your situation. It really can help create a sense of security within yourself that you know you can be authentic and true to your core with them, and they won't judge you for that. And then in return, they can be that way for you too. So it's really kind of that close bond between folks. And sometimes when we're going through cancer and cancer treatment, our emotional intimacy can really get impacted by that because of our own feelings on things. You're going through a crisis, right? You don't have time maybe to focus on your coupleship or your partners. You're just trying to survive the day to day. So sometimes we can see emotional intimacy struggling during cancer and cancer treatment until we get to a point where maybe we can have those conversations once we're in a routine or once things is finished, so you all can get like back on track with each other. So some ways to go about to try to improve emotional intimacy is to maintain an open dialogue, really work on being empathetic for one each other instead of defensive. And what I mean by that is like, you know, not just be when someone says it really is hard for me to have this conversation with you, or really makes me upset when this happens, instead of being on the defensive, really try to be open and listening to them and being engaged with them instead of just formulating your response or getting defensive. And sometimes conflict can occur, and that's okay. You have to have some conflict to discuss these difficult issues and create boundaries that are healthy for each other. As part of maintaining these open dialogues, it's really helping you also be vulnerable. And when you're vulnerable with your partner, it signals that you trust that person and helps your partner feel like they can trust you. And if we avoid conflict, if we avoid vulnerability, that can be like the nemesis of intimacy because you're guarding yourself and your feelings. And that can actually distance you from your partner instead of bringing you together. So it really is kind of working on that open communication and vulnerability in your partnership so you can kind of get that emotional closeness again. Other things you can try to do to improve emotional intimacy is to like express yourself. And that's showing your love and appreciation without fear. Sometimes that could be giving compliments and reminding your partner why you love and appreciate them. And then in return, they'll compliment and talk to you about why they love and appreciate you. So it's that reciprocity that you are looking for in a relationship. And sometimes you really need to just work on yourself. Sometimes working on yourself and everything that you've been through can really help your relationship thrive. Because if you're feeling stuck or unsure, then your partnership is also stuck and unsure. And sometimes doing some individual therapy as well as maybe some couples work can really kind of help you guys helping folks find a place to start and to really kind of work on improving this if these tips feel a little overwhelming or difficult to do. And Another thing is maybe make a plan for intimacy where you block out set times to create a safe space where intimacy can grow. And this doesn't mean, again, we're talking about emotional intimacy. So maybe this is, everything is crazy with kids or with work or with stress from whatever. Maybe making sure you block an hour a couple times a week where it's just you and your partner without electronics on the couch or in the bedroom. Or going on a walk or going out to dinner, just like the two of you guys, so you can create that intimacy for that to grow and reconnect. Because intimacy isn't always spontaneous. Sometimes you have to work on creating those moments, especially when you have a lot going on in your life. As how body image can impact emotional intimacy, it can also impact physical intimacy. So there's some common difficulties that we see for men during and after cancer treatment are things like erectile dysfunction, a loss of confidence, a loss of desire, anxiety, depression, infertility. And for women, very similarly, we see many of those things, as well as early pain during intercourse, early menopause, the loss of confidence and sexual desire, anxiety, depression, and infertility. So what are some things to keep in mind if you want to improve physical intimacy? The first thing is to really get educated, that there are often options available from a medical professional that can help improve physical intimacy. For example, there could be a sexual health clinic that can kind of help address some of these concerns. If you are wanting to be physically intimate, which not everyone wants to do, but you're having pain with intercourse, or you're having anxiety surrounding this intimate touch, especially if you have scars or are still recovering from surgery, then sometimes a sexual health clinician can help physically manage some of those things by prescribing medications or techniques to help the physical side of the sexual functioning. Oftentimes, you may also need to redefine sex. Physical intimacy and sex are not necessarily the same thing. And when I talk about sex, I usually, physical intimacy, when we think about that, usually we think of penetrative sex or orgasm as the defined end goal of it. And that's not always the case. Sometimes we don't want to have that happen again. Maybe we want to explore other options to improve connection, such as some sensual touching, kissing, utilizing oral sex, or utilizing other equipment in the bedroom to kind of help with that connection. And also can also be like really kind of being mindful and present in the bedroom if this is something you want to explore, by learning how to tune into these sensations and be present and trying to kind of have everything else fade away and just being there with your partner, really enjoying or learning how to touch and to be physical again. For some individuals, this can be really difficult to kind of be more present in the moment, either because we are anxious about being in the bedroom again or introducing that physical intimacy back into our relationship, or maybe even something that I don't really talk about here, but we could have a whole conversation and discussion on, is dating during and after cancer treatment. So if we're feeling anxious about initiating some kind of form of physical intimacy, it might be really helpful to do some relaxation techniques before it even gets to that point where intimacy is introduced. One of the relaxation techniques I like to encourage patients to use is the 4-7-8 breathing, where you breathe in quickly and deeply for over 4 seconds. You hold your breath in for 7 and you release and exhale slowly and precisely over 8. And using this kind of breathing exercise can really help you feel more centered. You can feel your body a little bit more. You're more in tune to things. And it might also help quiet your mind a little bit. And I think something else to keep in mind is when you're wanting to start physical intimacy, that doesn't necessarily, again, mean penetrative sex and orgasm. It can be just relearning, how do you like to be with a partner again? And how do you like to be touched? One way to kind of start by doing this is through body mapping. And you use the outline of like a shape of a body, the front and back, and you color it according to how you would like to be touched. Where green is, you can touch me here at any point in time. I love it. This is really something that I enjoy feeling. Yellow, maybe it depends. Sometimes I like this, sometimes not. Always check. And red is like, no, stop, don't touch me there. And this might be really useful if you are do have some maybe lasting body changes from cancer treatment. Maybe you don't want a scar to be touched, or maybe there is some sensitivity in areas that really just don't feel good for you to be touched in that way. Maybe those are yellow and reds. And I think it's always good to kind of revisit this exercise with your partner, because as you go through treatment and you finish treatment over time, your body map may change, where there might be some areas that turn from yellow and red more to green with time and healing. So as I said before, don't rush the process. Good things take time. There's not a specific blueprint to improving intimacy. You have to have these conversations with your partner and be open to the fact that it may move back and forth, and that's okay. It's not going to, improve, go up, on its own. There might be a little bit move forward and then a little bit move backward. It's just going to take some time. As long as you're having great communication with your partner and you're both in a place where you feel comfortable, then that's okay. However, if the relationship does seem stuck and you're having more shuffles backwards, you're not able to move forward, or you're not feeling fulfilled, then couples counseling might be a great option for you. So what are some additional signs that you could maybe use some couples counseling, individual therapy, or assistance? You don't want to leave your house because you don't want people to see you. You don't want to date or meet new people. You avoid touching, being affectionate, or having sex with your partner. You're afraid to undressing your partner. You won't let your partner see your scars. You're embarrassed because you maybe lost or gained some weight. You feel ashamed for having cancer, and you're unable to accept yourself for who you are now, or kind of living in that past. And I do kind of also want to make the distinction that some people are just not physically intimate folks, and that's okay. I think it's just kind of figuring out, if you did have intimacy before, why do we not want to have, or why does physical intimacy not seem as important now, or not something that we want to do? Is there anxiety or depression that we can need to talk to somebody through? Or have we just kind of decided for ourselves that that's not an important part of our life anymore, and we want to focus on other things? So I think it's just kind of working with yourself and maybe with a licensed therapist as to, where is your head at in all of this? Because I'm a big believer in therapy and counseling. Obviously, I'm a mental health professional. And so just kind of getting to the root as to, if you were having these intimate moments, physically intimate moments before, and we're not having them now, is that because of pain, fear, anxiety, or is it something else? And if it's something else and that's just not something that you feel is a value to you anymore, that's fine. And there's some great resources for that we're going to talk about here, or that the next speaker is going to be talking about here. And I think something else is to really talk with your doctor at the cancer center and see if they can connect you to a sexual health medical provider, or to your social work team who can provide resources to community providers. So I know in Northwestern Medicine, they do have a women's sexual health and menopause clinic at their downtown location. I do know that they offer support and some therapy surrounding some of those sexual dysfunctions, and helping with intimacy concerns. I don't know of any in the suburbs, but that doesn't mean that they don't exist. The doctors themselves may know or have an idea of who to refer you to, or if not, then the social workers usually have a good list of some resources or folks in the community that can kind of help you address some of these things. Whether it be physically, you are not able to be intimate because of your physical sexual functioning, that is something you want to improve, or emotionally, we need some work to help us become emotionally and physically more comfortable with intimacy, or is this something that we don't really want to pursue? Let's just make sure that you are still being true to yourself. And so that was my presentation. So this is my contact info. I'm happy if there's follow-up questions. You can certainly shoot me an email at this or give me a call. I'm happy to troubleshoot things. I'm not a medical provider, but I am a sexual health educator. I'm a therapist, so happy to kind of troubleshoot if there is more specific questions later on, or you want some more information on something.
So I'm a 9-year breast cancer survivor, and prior to my diagnosis, I had always had painful intercourse. I had endometriosis. I eventually developed a condition called vaginismus, where internal penetration was impossible. And I started doing treatment for it, but shortly after that, being diagnosed with the vaginismus, I found a breast lump in the shower. I was 36 years old. I ended up having 3 tumors on my left breast, and they were considered to be estrogen positive breast cancer. So the goal was to get rid of all the estrogen in my body. And when I talked to the oncologist, he said you need to have chemotherapy, you have to have eventually a total hysterectomy, you're going to have painful intercourse, vaginal dryness, and lack of libido. And I just looked at him, I'm like, wait, I already had all this, and now I have cancer, and it's gonna get worse. And it did get worse, and it was very frustrating because I thought, okay, I had to have a double mastectomy. I had to get rid of my uterus, and I lost all my hair. I had to go through all this treatment. It's like now I can't even have sex. It's like impossible, and it's just painful, and it was very frustrating. I was married at the time for 20 years, and when my marriage came to an end 3 years ago, I wondered how I was going to date again, because I thought I've never dated anybody before. I was with my same partner since the 8th grade, so we were together for a long time, and I thought I can't use a traditional dating app, because how am I going to explain to somebody that I can't have intercourse? I desired other forms of intimacy. I just can't have internal penetration, and I thought, well, maybe it's just easier to be single, because I just started putting myself through that scenario of meeting somebody that I liked and then have to tell them that I can't have sex, and I thought I just couldn't put up with that. I was just too intimidated by traditional dating apps. Then I started wondering, what do guys do? What do men do that have erectile dysfunction? We didn't choose to have this sexual dysfunction or limitations, and I wondered how they dated, and I found that they were going on traditional dating apps. It's just that they were getting rejected themselves. They would have to tell the person that maybe they had diabetes and they had erectile dysfunction, or they had uh, high blood pressure, or cancer, prostate cancer, or maybe something called Peyronie's disease, where it's abnormal curvature of the penis that can make sexual intercourse impossible as well. And I thought, how do they date? And I thought, that's not fair that we have to feel this intimidation, and we deserve to be loved too. So I thought, what can I do to help these individuals like myself to find companionship without the fear of being rejected or embarrassed? And that's when I decided to create a dating app called Entwine. It's ENTWINE, dating.com. And it takes the sexual expectations out of dating or relationships, so that you don't have to worry about entering the dating world and wondering if that person's going to accept you just the way you are. It's just known right away. The cards are on the table. If you use this dating app, intercourse may not be a possibility. And that's what I decided to do. So it launched the end of August of 2021, and I'm really passionate about it. It's a free app, and it's very needed, because I didn't realize how many men have erectile dysfunction, how many women are struggling silently as well with this sexual limitations, and they think they're just too intimidated to go out there and meet somebody. And I want everybody to know that if you are single and you're looking to date, this could be something that you can use to find companionship, and you can just be yourself, and you don't even have to tell anybody what your sexual limitation is. You may not even have a sexual limitation. There's people on the app right now that don't have the sexual limitations. It's just that they crave that emotional intimacy, because there's other forms of intimacy, like Becky was saying. It can be holding hands, cuddling. It doesn't have to be internal penetration. And so if you do struggle with the limitations, there's hope for you. There's somebody out there. You don't have to struggle and silently. And I'm hoping there's somebody out there for you. I'm sure there is. It's just you have to get that courage to check out Entwine, and hopefully find somebody They will accept you just the way you are.
I think that's so great. And I think it's really kind of highlighting that there are a lot of forms of intimacy, as I kind of hinted at, not just emotional and physical. There's a lot of intellectual intimacy, spiritual intimacy, things like that. So I think entwine or working on really connecting on those different levels, especially because sometimes, as we know, cancer and cancer treatment can change your bodies for a very long time, or other conditions like endometriosis, diabetes, even depression and anxiety can really impact your sexual functioning. So I think it's kind of working with it yourself and even with a licensed professional as to what are those barriers, what are some things that we could, see about fulfilling you in that way that you want to be fulfilled, whether that be physically and sexually or in other areas. So I think that it's great that something like that is offered to folks where they can kind of, if they're not able to or interested in that piece of it, connect on a deep level with like-minded individuals. I think that's great.